The pancreas, a little but vital organ located beneath your stomach, has two main functions for your body. It produces enzymes that aid in food digestion and hormones like insulin that control blood sugar levels. However, a number of illnesses, such as pancreatitis and even pancreatic cancer, can result from problems with the pancreas. Early detection of symptoms is crucial because both illnesses have a risk of death.
Hey there, and welcome back to our channel. Whether you're a returning viewer or new here, thank you for joining us today. If you're new, don't forget to subscribe to stay updated on our latest health and wellness content. Today's video is focused on something extremely important but often overlooked: pancreatic disease. Now, you might have heard about it, but what exactly does it mean? And what are the early signs you should be aware of? We'll be discussing the 10 signs of pancreatic disease that could help save lives through early detection.
The history of pancreatic disease and its understanding has evolved significantly over centuries, from early anatomical discoveries to modern diagnostic and treatment approaches.
Ancient and early medical understanding.
The pancreas was initially mentioned in Greek literature. Although its purpose was still unknown, Herophilus, an anatomist from the 4th century BCE, is sometimes credited with finding the pancreas. The Greek physician Rufus of Ephesus later used the word pancreas to refer to the soft texture of the organ. He derived it from the Greek words panol and cheese, flesh, in the 2nd century CE. For many decades, the function of the pancreas in digestion and blood sugar management was unknown, even though it was identified anatomic. Early anatomists and doctors knew very little about its significance or how diseases are related to it.
19th century developments.
A deeper comprehension of the pancreas was possible in the 19th century thanks to developments in anatomy and physiology. The research of the pancreas function in digestion, namely the release of pancreatic enzymes that aid in the breakdown of proteins and lipids, was done by the French scientist Claude Bernard (1813 to 1878), who made important contributions. The foundation for comprehending exocrine pancreatic function, the organ's function in digestion, was established by Bernard's investigations. The endocrine role of the pancreas was discovered in the 19th century, which was another significant accomplishment. German physician Paul Langerhans discovered cell clusters inside the pancreas in 1869. These clusters were subsequently called the islets of Langerhans. It is now understood that these cells generate the hormone insulin, which is crucial for controlling blood sugar levels.
Discovery of insulin and diabetes.
One of the most significant findings pertaining to the pancreas occurred at the beginning of the 20th century: insulin. Canadian scientists Charles Best, Frederick Banting, John MacLeod, and James Collip succeeded in isolating insulin from the pancreas in 1921. This finding completely changed the way diabetes, a condition caused by the pancreas' inability to produce enough insulin, is treated. Today we'll explore the 10 most common signs that may suggest you have pancreatic disease. Some of these symptoms can be subtle, but knowing them early can make all the difference. Let's get started.
1. Persistent abdominal pain.
Persistent abdominal pain is one of the most significant indicators of pancreatic illness. The discomfort is usually described as a dull or intense aching and usually starts in the upper abdomen, just behind the rib cage. Your back may experience radiating discomfort, particularly in the mid or lower back.
Eating, particularly high-fat foods, can exacerbate pancreatic pain because the pancreas must work harder to create digesting enzymes. Should this discomfort continue for several days or weeks, it could indicate pancreatitis, an inflammation of the pancreas, or possibly pancreatic cancer. Consistent pain in this location should never be disregarded, especially if it persists. 2. Jaundice, yellowing of skin and eyes.
Now, jaundice is a crucial symptom to keep an eye out for. This is the accumulation of the liver-produced chemical bilirubin, which is responsible for the yellowing of your skin and the whites of your eyes. But what connection does this have to the pancreas? Bile duct obstruction results in jaundice. Bile cannot travel through this duct since it passes through the pancreas, hence bilirubin builds up when a pancreatic tumor or inflammation obstructs it. Jaundice, especially when combined with other symptoms on this list, may be an early warning indication of pancreatic cancer. Seek medical assistance right once if you observe yellowing of the skin, especially if you do not have any other liver-related disorders.
3. Unexplained weight loss.
Unaccounted for weight loss is another indicator that needs to be taken seriously. Weight loss typically results from purposefully reducing your intake of food or increasing your physical activity. But if you're dropping pounds without trying, that can mean your pancreas isn't functioning properly. The enzymes that degrade proteins, lipids, and carbohydrates in diet are released by the pancreas. A malfunctioning pancreas prevents food from being completely broken down, which results in malabsorption. This indicates that there is a rapid decrease of body weight due to improper food absorption. If experienced, this symptom is typical of those with pancreatic cancer or chronic pancreatitis and should be checked out right once by a physician.
4. Nausea and vomiting.
After eating, have you ever had nausea or the want to throw up? This is a broad symptom that can indicate a variety of illnesses, but it also serves as an early warning indicator of pancreatic cancer. Digestion is hampered when your pancreas is inflamed or compromised by illness. This problem can result in poor digestion of food, which can induce nausea, vomiting, and pain, particularly after consuming rich or fatty foods. This may be a sign of acute or chronic pancreatitis, or possibly a more serious problem if it starts to occur frequently, especially after every meal.
5. Digestive problems, diarrhea, bloating, and fatty stools.
An additional prevalent indicator of pancreatic illness is digestive issues. This can include bloating, diarrhea, or the passing of greasy, fatty feces, a disease called steatorrhea. Your body finds it difficult to effectively break down and absorb fats when the pancreas isn't releasing enough enzymes. This may lead to oily, loose, and frequently floating feces in the toilet. Steatorrhea should be evaluated if it happens frequently, since it is a classic sign of both exocrine pancreatic insufficiency and chronic pancreatitis.
6. Loss of appetite.
Have you experienced an abrupt decrease in appetite? Although everyone experiences some days when they don't feel particularly hungry, a chronic and inexplicable loss of appetite may indicate pancreatic illness. An inflammatory pancreas can cause discomfort in the abdomen, which might decrease one's appetite. This symptom can arise in cases of pancreatitis or pancreatic cancer and frequently coexists with inexplicable weight loss. You should see your doctor if you notice that your appetite has considerably decreased.
7. New onset of diabetes.
A lot of people are unaware of how important the pancreas is in controlling blood sugar. Diabetes can result from injury to the pancreas that affects its capacity to make insulin, particularly in cases of pancreatic cancer or chronic pancreatitis. If you are otherwise healthy and get diabetes suddenly, especially if you don't have a family history of the disease, it may be an indication of a pancreatic issue. Diabetes can occasionally be a precursor to pancreatic cancer, therefore it's important to pay attention to this symptom.
8. Dark urine and pale stools.
Changes in the color of your feces or urine may also be a sign of a pancreatitis. High blood levels of bilirubin may be the cause if your urine becomes dark. Similar to this, light-colored or clay-colored feces are frequently an indication that the bile duct is blocked, which can be brought on by a pancreatic problem and prevent the bile from flowing normally. If these changes happen consistently, and are accompanied by other symptoms like jaundice or abdominal pain, you should seek medical attention to rule out pancreatic cancer or acute pancreatitis.
9. Fatigue and weakness.
A further symptom to watch out for is weakness and exhaustion. Malnutrition can result from an ineffective pancreas, which can impair your body's ability to absorb nutrients from food and leave you feeling tired all over. People who have pancreatic cancer or chronic pancreatitis frequently experience fatigue, weakness, and an inability to do daily chores. It is important visiting a physician to rule out pancreatic problems if you are experiencing these symptoms and are unable to explain them.
10. Fever and sweating.
Lastly, a fever and profuse perspiration may indicate that your body is battling an inflammation or infection. When the pancreas is significantly inflamed, as occurs in acute pancreatitis, this is especially prevalent. A fever is frequently a sign that an infection or inflammation is being dealt with by your immune system. If fever and sweating occur alongside other symptoms like abdominal pain or nausea, seek medical attention immediately, as it could be a sign of a serious infection or complication. There you have it, the 10 indicators of pancreatic cancer that everyone needs to know about. Paying attention to these symptoms could potentially save your life or the life of someone you care about, so early detection is crucial.
If any of these symptoms apply to you or someone you know, please see a healthcare professional for a more thorough assessment. It's always preferable to exercise caution and identify any possible issues early on.
Appreciate you seeing the video for today. We hope this information was helpful to you. If so, kindly like, comment, and subscribe to our channel in order to receive more advice and insights about health. Please leave a comment below if you have any queries or suggestions for topics we should
subscribe to my channel.